Welcome back to our discussion on the pelvic floor. I'm here with Dr. Elizabeth Brown and physical therapist Clarice Sinson. In this section, let's dive into what happens when the pelvic floor isn't working as it should, what causes conditions, how they are diagnosed, and what to expect from treatment. So let's talk about that. Clarice, how does the pelvic floor function and what happens when it doesn't function properly?
Yeah. So I want you guys to think pelvic floor is like any irregular joint in our body, any like regular like muscle in our body. It has to have full range of motion. And we're talking about full contraction and full like lengthening, right? So if our like pelvic floor is like very tight and it's not giving into like full range of motion, you're not going to have that like optimal strength that it can like give our body, or like that support that it can give our body. So just like any muscle, it has to have full range, full contraction, and full lengthening. What happens when it doesn't function properly? Same thing, because pelvic floor really like affects our like core stability. When it's not functioning well, it can definitely affect lumbar stability, pelvis stability, breathing. It can go all the way down to breathing. And sometimes it can cause pain for sure. It can be pain with like our pelvis or urinary like incontinence, like stuff like that.
Okay, and Dr. Brown, what could cause the pelvic floor to function improperly, and when would someone know to seek medical care for this?
Yeah, that's a great question. And I'll try to give a streamlined answer to what is a very complex process. So, for example, if someone has irritable bowel syndrome or endometriosis and there are pain signals being sent from the organs of our body, we interpret that it gets sent to our brain essentially, and then signals get sent back to our body. And sometimes that can manifest in the pelvic floor muscles, and they can kind of respond with maladaptive firing patterns or tightness. And sometimes that can kind of spill over to surrounding muscles that affect our lumbar spine or our hips. So the pelvic floor is intimately connected with hip function and spine function. And so that's why sometimes we can see a lot of overlap of pelvic pain with the neighboring regions.
So, what sort of common complaints when a patient comes into your office makes you think that it's the pelvic floor is something that is maybe the cause?
When I evaluate a patient, if someone comes to me with a pelvic floor evaluation, I always ask about their symptoms, where they feel pain. I ask about back pain, hip pain, urinary function, bowel function, sexual function. I ask about menstrual history, birth history. And then as part of my exam, I do a full back exam, hip exam, and then I move on to the pelvic floor exam. So sometimes it's tricky because usually I will have a high suspicion for someone having pelvic floor involvement if multiple of those areas like bowel, bladder function are affected, or they have a history of gynecologic surgery, hip surgery, etc. And then so that will point me in the direction, but sometimes it's tricky because sometimes they're not saying they have any of those symptoms, yet they still have pelvic floor involvement, and that's why I do my exam and I explain the reason behind the exam to the patient, and we can kind of investigate that way.
And what are the sort of most common pelvic floor disorders, and how are they diagnosed?
The most common ones are urinary incontinence, pelvic organ prolapse, and fecal incontinence, generally. But I think it's a combination approach. So I find in my patients often, if they're having urinary symptoms, they'll present first to maybe their primary care physician, and then maybe they get referred to urology. And then if they have a negative urology workup, they come to pelvic floor physical therapist, and then maybe they'll come to me to assess the musculoskeletal component. And I explain that to my patients too. I say, I am focusing on the musculoskeletal system. It might be that we need to involve some of our other specialists.
So it
it can
sounds like an interdisciplinary
exactly. It's definitely interdisciplinary.
And how are they treated? How do you treat these pelvic floor disorders typically?
So it depends, but I'll lay out kind of the options because it can range from just working with an incredible physical therapist who's knowledgeable in the pelvic floor, and have the therapist incorporate strengthening not just of the pelvic floor but the hip muscles, back muscles, working on breathing. Sometimes a patient might benefit from medication. So there are suppositories that you can use rectally or vaginally to help kind of calm down the muscles if they're tight. In rarer cases, patients might benefit from pelvic floor injections. Sometimes treatment will also include talking with psychology, pain psychology, sex therapy, things like this.
And Clarice, you treat this. So, what are some common challenges when treating the pelvic floor?
I think first of all, like it's still like a taboo topic. So like people come in and they're like, you start asking about like their history of like incontinence, or I can start seeing like someone who's in their 60s who had three vaginal births, and they're like, why are you asking about like my birth history? I'm like, I have grandkids at this point. So I feel like just getting people to like talk about it and to kind of like relate their pelvic floor issue and what they're coming into physical therapy, I'd say like people need to have a better understanding that they are very like connected, and like pelvic floor dysfunction can present beyond like incontinence. It can present as like a musculoskeletal dysfunction. um the other thing too, which I like totally understand, when you're dealing with like pelvic floor dysfunction, it does go beyond like musculoskeletal health. There could be like trauma involved as well. So that's something that, like if you want to do internal assessment with this patient, it's something that we have to be careful about. And if they're not yet open to internal assessment, that's okay. We can definitely do a lot of like external like physical therapy, or like seeing like other specialists for it as well.
And this is really for both of you. How would someone find a specialist, whether a physician or a physical therapist that is specializes in pelvic floor?
Everyone, let's start talking about it. I think let's normalize that pelvic, it's nothing to be ashamed about. Like pelvic floor dysfunction happens. It's common, but it's not normal. Talk to it. Like if you're seeing a physical therapist, talk to your physical therapist about it. They would definitely like know someone that's in network that can like, like refer you to like another pelvic floor specialist, or like to someone like Dr. Brown. There's definitely like physiatrists or people in like rehab medicine that specializes in pelvic floor.
Agree. Yeah, we should definitely talk about it more.
Yeah.
I think totally agree with you, Clarice. I think also HSS has the Women's Sports Medicine Center and perinatal group. So having groups that are focused around pelvic health is important. Doing things like this and talking more about pelvic health is a way to help bring patients to pelvic health specialists. And then outside of our hospital, just talking with your primary care about pelvic function, your urologist, gynecologist, gastroenterologist, just talk about it and you will find your way. I will say I do try to educate my patients on finding a pelvic floor physical therapist with like excellent training. And so there are a couple of organizations that hold these trainings. One of them is the APTA, another is Herman and Wallace. And Clarice has done hours and hours of training. And so I always tell my patients I look for certain certifications as well.
So if you were like to go to the, excuse me, if you could go to those websites, you could find lists of people in your area maybe that have the certifications that you're looking for.
They do, yes. They have very nice search functions.
Very helpful.